Next, we have Dr. Larry Bramlage. Probably the phrase needs no introduction is apt here. I've always thought that if I were in school and Larry was a professor, even I would have been a good student. He's brilliant at explaining things in a way that you can understand. He, of course, is affiliated with the Rood and Riddle Equine Hospital. He has been on the on-call program with the AAP for many years. He's a past president of the AAP, recipient of many honors. The one I can pronounce is the Jockey Club Medal, and it's a pleasure to introduce Dr. Larry Bramlage.
Thanks, Ed. I'm a little froggy. I've had a cold for about 10 days. Those little airplanes are amazing as epidemiologic vehicles, Tim. You ought to study them. The crux of my talk is, as 12 years as the chairman of the Research Advisory Committee to the Grace and Jockey Club Research Foundation, I had the occasion to talk to Ed multiple times. Each time we would talk, he'd often have a question of, did you see the article that so-and-so wrote or so-and-so presentation they gave? How does that fit into the training of a racehorse? So I should have titled this question Selected by Ed, because that's what we're going to talk about, is how the horse's skeleton trains. Many times, maybe most times, and some trainers all the time, the trainers regard the lameness as the problem as opposed to a sign of a problem, which is really more accurate. That's the way the horse would look at it. And understanding the problem and preventing it rather than treating it is always preferable. So now that I've gutted Wayne's talk, I'm going to move on and continue with mine. So what is lameness? By the purest definition, it's the shifting of weight from one limb to the other. A normal horse is perfectly symmetrical, bearing symmetrical weight on both front, both hind, and relative front to hind in its normal proportion. So what causes lameness is pain. There's a few mechanical lamenesses, but not very many. For the most part, it's an area of discomfort, and horses are wonderful at dealing with areas of discomfort. They'll shift their gait without any problem and keep right on training. They're amazing. They're much different than people. So what causes pain? Inflammation. And Mary's already given this answer away. What are the 4 signs of inflammation? In Latin, it's swelling, heat, pain, and redness. And you can't see redness very well, so we're stuck with the other 3. So what causes the swelling, heat, pain, and inflammation in the horse? Trauma. We have these other opportunities, neoplasia, immune response, degeneration, and metabolic disorders that are general categories of diseases. But when we're talking about horses and lameness, it's trauma. And what kind of trauma? For all practical purposes in the racehorse, it's a stress fracture. It takes a tremendous force to break a horse's bone. You almost never have a single overwhelming force that can break the bone of a horse. You usually got fractures of the long bones only in foals. And often they're at areas of growth or places where the bones are inherently weaker. But one horse kicking another horse, it's pretty rare to fracture one of the major bones. So what is a stress fracture? Stress fractures are caused by multiple submaximal loads, cyclic stress, training. I mean, that's the definition of what we do to a horse. Repetitive cyclic stress is how you train a horse. It can be your friend, but it also can be dangerous. And I'm going to refer to this study by Sue Stover. I hope you guys can see those a little better than I can. They're washing out a little. The high-speed exercise history and catastrophic racing fractures in thoroughbreds. In that study, a horse that accumulated a total of 35 furlongs in a 2-month period of time was almost 4 times more likely to get an injury than a horse that had 25 furlongs accumulated in a 2-month period of time. That's the difference between breezing a half mile and 3/8 every week. That's really not a lot of accumulated high-speed furlongs, whether you're racing or whether those are timed works. So you can see we're training and racing horses right at the level of their physiology. And so we have to be cognizant of that 3.9-fold, there's somewhat of a cliff there. Now, I'm sure she's going to talk about it, so I'm going to move on. Why don't all horses break their bones? I mean, eventually they should fail if they're accumulating damage at that rate. Well, the reason they don't fail is because they heal. Same thing with people. And they heal. Interestingly, we heal while we sleep. But horses don't heal while they sleep. They heal while they rest. And I'll come back to that here in a little bit. The horses repair themselves between exercise period, but there's a limit on that repair process, and you can overwhelm it with training. All horses get the same disease, but the level of performance and the extreme ability of the thoroughbred racehorse magnifies its effects on the skeleton. Why? Because they have such wonderful heart and lungs. They can train so much better and so much faster than a person can as far as their heart and lungs adaptation that we don't even get close. Interval training was invented to improve the training of the heart and lungs in people. Interval training in thoroughbred racehorses doesn't work. That became popular. In fact, when I was at Ohio State, the first person to publish a lot on interval training was Dr. Fox at Ohio State in the College of Medicine. But he accounted for 5-year-old maidens at Beulah Park with splints on their hind legs because they just can't stand that amount of interval training over and over and over. The skeleton is not that durable. The musculoskeletal system can't stand the training, but the heart and lungs require it. So we have to understand why does the skeleton require training and such delicate training as opposed to the heart and lungs. Well, the skeleton literally has to be modeled into the performance skeleton of a thoroughbred racehorse. You could give them a draft horse skeleton and they would probably not break it down, but that's too much weight for them to carry. And so the reason a thoroughbred horse is close to a Ferrari is because it carries as little excess weight as it possibly can. But it has to have enough structure that it can get around the racetrack. And so how do we accomplish that? Well, breeding, certainly. A thoroughbred racehorse should look like a thoroughbred racehorse. That's called modeling of the skeleton. And then adaptive training, which once you start training, added size is also modeling, but also remodeling is the changing of a substance from one characteristic to another. It's work specific. The skeleton adapts to the work you show it. And bone is amazing in that way. I mean, it's one of the reasons why I'm an orthopedic surgeon. Bone is so amazing, it can train really rapidly to get to a position, relatively rapidly, I should say, but it'll also detrain if you don't give it a reason to stay there. If you don't give it a reason to stay strong, the bone gets weaker. So training is very dynamic in the horse. How much load does it take a bone to see to make it stronger? This is really interesting. This is I'm sure you can't see this, but this is a paper out quite a few years ago out of the Journal of Bone and Joint Surgery. It's a real scientifically, I think, high point for research. They put turkeys in vices, and they had them flap their one wing in order to get fed, and the other wing stayed tied tight to the horse's limb. And what they were looking at is how many cycles a day does the bone need in order to make it stronger? And the answer was very interesting, 36. That's really not very many. For a racehorse, that's a little more than a furlong. So bone trains to the level of work, not through the cardiovascular system. For heart and lungs to increase in their capacity, hearts and lungs need volumes of work. Same is true of muscle to a degree. Muscle has a lot of genetic component. It's either fast twitch or slow twitch. And a lot of what you have as far as your muscle makeup is genetic, maybe a lot higher than heart and lungs, and certainly a lot higher than the skeleton. The skeleton is made. So the highest load of 36 cycles today guides the bone response. That's a little better than a furlong. All the rest of the exercise today is trauma. So if you're going out and galloping a horse a lot, His 36 highest cycles are going to tell his bone what to do. So if you have an exercise rider who you think is a really good exercise rider and they gallop the horse at exactly the same speed all the way around the racetrack, you probably just made his skeleton weaker. 1 furlong should be a little faster than the rest, especially in the young horses. If you let them out a little bit on Tuesday, that furlong governs where the bone is going to be the next time the horse goes to exercise. And so the ideal work would be enough work to exercise the heart and lungs with 1 furlong to tell the bone where it's got to go next week when you breeze him again. So that little bit of an extra furlong keeps the bone ahead of the rest of the skeleton if you can manage that. Now, Julius Wolff is a German, and he described this thing that we all learn in veterinary school as Wolff's law, and that bone is laid down where the strength is needed and removed where the strength is unnecessary. Bone's very dynamic. Well, horses carry this to an extreme, and so how do they do that? Well, they overload, and they over-repair, and they overload, and they over-repair, and you should stair-step your way to a racehorse. You want to make these little steps all the way up the ladder so that eventually you get a racehorse skeleton. You have to give the horse the load at a rate that he can withstand in order to strengthen his bone to get him the place to where he can race. Over-repair is called hypertrophy. Now, there's 1 of 2 ways you can make adaptations in the bone. You can change the structure from this density to that density, or you can change the shape. If you take the exact same amount of material, here's a diagram down here of the exact same volume of material, and if you increase the diameter of the circle and leave a hole in the middle, you double the bending strength. And that's what a horse does to his cannon bone. He just keeps adding bone on the outside of the cannon bone in order to make it stronger. And if you ask him to make it too fast, what happens? He bucks his shins, because he's trying to make it as fast as he can. So you're giving him reason to make more bone, but he can't keep up. And so he gets behind, so the shins get sore. But that's not the only place that happens. In fact, it's probably not even the most important place. And it might even be helpful, because it's a way for the horse to tell you, I can't go that fast. I can't make skeleton that fast. You got to give me more time between, or you got to change something. You might need to change what I'm doing between my exercise works. So here's the 2 places where they make the most bone: on the dorsal surface of the shin and on the caudal surface of the tibia. They're not born with the racehorse skeleton, so those 2 bones have to hypertrophy. Other sites develop similarly, but these are the 2 places that do it the most. And what do? They add density. They change somewhat the structure of the crystals within the bone, and they also add size. They add size to the cannon bone. They make that circle bigger, so the bending strength is stronger. So again, I hope you can see this better. The lights are washing it out a little, but when you do this overload, over-repair, if the bone failure will occur in the absence of adequate repair, and that adequate repair depends on a lot of things. It depends on how fast you give him the exercise, how capable he is of making the response, and what we do to them in between. And if they get behind, they get the classic stress fracture. This is also a stress fracture. Starts down here, shaken. Starts down here and works its way up. Very seldom. The idea that a condylar fracture is caused by a bad step, it's not caused by a bad step. It can be precipitated by a bad step. They hit an uneven area in the racetrack and load that bone abnormally, but if it's a totally normal bone, abnormal load's not going to affect it. But if you load a bone that's got a predisposing problem in the bone, then it will. Well, in actual fact, once the horse gets to a racehorse skeleton, he still has to maintain. He'll overload and over-repair and overload and over-repair. And biologic systems stay in the plastic range. Now, if they're building a bridge, the engineers get together and they determine where the plastic elastic limit is for that steel in the bridge, and then they put enough steel in that it's elastic, meaning that it can bend back and forth. It never does any structural damage. Biologic systems always stay in the plastic range. Because if the skeleton gets really, really strong, stronger than the load that it's seeing, the cells in the bone take it away because it's excess bone. You don't need it to carry the load that the horses are seeing. So it's always dynamic and it's always plastic, meaning that the training is always doing little bits of damage and the horse is always repairing it. And so high-speed furlongs result in damage that must be healed. Remember Sue's paper? So we don't have an elastic skeleton. The horses and us have plastic skeletons. We'll overload and over-repair, but the truth is you never get 100% repair. You always have a little residual damage that it takes some time for the horse to catch up. So the horse really never gets back to baseline. So over time, you can't keep a horse peaked for an excessively long period of time, nor can you keep a person. And this is the classic sort of bell-shaped curve where 68% of the people are within the standard deviations here. The data can't be just equally matched, but that data of Sue's with the 35 to 25 is going to be somewhere here in the middle range for those horses. And then you're going to have another standard deviation out here that gets you up to 95%, and that, in fact, is where that 5% confidence in the 95% confidence interval came from that Tim was talking about. It's an arbitrary scenario. But the key thing here is that there are some horses that are in this top 2.5% that you can give them the training as fast as you want to give it to them, and they'll keep up. You can't injure them. They have a biologic system that can keep up. Conversely, you got some horses down on this end that no matter what you do with them, you can't get them to the races. They're not made of the things racehorses are made of. There's population dynamics, so each individual is going to train someplace in between, and that's what makes it hard on a trainer. Now, there are exceptions. Edwin Moses won 40 400-meter hurdle races in 4 years, never missed a major event, never lost. Serena Song made 34 starts in 3 years. Mary said she'd never seen a perfect horse. When she came out of racing, her legs were as perfect as I've ever seen one. I bet that would be nearly a perfect pre-race exam. Usain Bolt couldn't stay peaked for all of the year last year, but he certainly peaked for the Olympics. Really high-level athletes cycle up and down usually in that 95% middle portion of the population. I want to point out one more thing because I'm going to make a point of it here in a minute. Look at these sprinters. Every one of them toes in. There's not been a 100-meter winner in the Olympics that didn't toe in. In people, that's highly associated with speed. And I think it might be in horses too. I'll tell you why I made that point in a minute. So adaptation is work specific. You can alter the balance by altering the input. In other words, galloping a horse the same speed all the time. This idea of galloping horses just to put a good base on them, I don't know where that came from. It's maybe good for their heart and lungs, but our problem is training their skeleton. They need that fast work. The Aiken trials were not such a bad idea. Those little speedy bursts of speed early on in the horse's training, as long as you didn't overdo it, because work's a product of intensity and frequency. And so little short bursts of speed actually shows the bone where it's going. Exclusivity is bad. If you're training only on this surface, you're more prone to wear the bone out. If you throw in some other surfaces, that gives the bone a chance to see other exercise, and that's especially true of varying speeds. Giving the horse a little bit of fast work and doing a little more jogging, because it's a repetitive cyclic load at one work level. So the bone is seeing the same thing continuously that the bone has trouble with. So the biggest problem is when you change exclusivity. About a month after the horses come back from south, let's say Gulfstream, and they go on to Churchill Downs, if they're just training at those two places, we'll see a spate of sore horses, because now you're using exclusivity in the surface of the load that the horse has seen, and it's different than he saw for the last 3 months. He's already adapted to the last 3 or 4 months. You give him something different. So you have to be aware that sometimes that causes a horse to get sore trying to adapt. So have we altered the raw material? Well, I think we have in a way, and I'll tell you why. Here, if you just divide the horse up into power, which is his muscles, support, which is his skeleton, and the energy system, which is the viscera and the weight, and estimate the weight, he's going to have not quite half of the horse is going to be muscle, about a fourth is going to be skeleton, and the rest is viscera and blood and everything else. That's a support system. Well, if you increase his muscle mass to a point, especially if you have the right twitch fibers, medium twitch fibers for a racehorse, that generally increases their power. Usually good racehorses are well muscled. If you increase their support, it's just dead weight. The support doesn't add anything to their speed. It just gets them around the racetrack. So if you can reduce their weight, and the way that the thoroughbred breed has done that is they're the minimum when we send them to racing, and then we train them into the skeleton that they have to have. And you can increase the energy system, that would be the viscera and everything that provides energy. If you increase that, you can make an argument for that making a better horse, because the trainers will tell you, if he won't eat, I can't train him. So they have to be able to keep up with that. But that adds dead weight to the horse as well. It's dead weight when they're racing. It may be better otherwise. So we've reduced the skeleton to where it's right on the edge of support. Are we moving the breed? I think maybe we are, because the mentality has changed in the era of television. The people pay for horses and want horses that run in the Triple Crown Breeders' Cup Weekend Stakes. That's how we make stallions. If you're right on the right 2 days, you can be a stallion. You have to be real prompt. Whereas used to be, the Vanderbilts chose their stallions because they were good to them over a long period of time. They won a bunch of races. They got them there on Saturday afternoon or Wednesday afternoon or whenever they had time to go between managing their railroads. And it was the horses that were good over a period of time that were stallions, not the horses that just were good during the Breeders' Cup. So which do we prefer? We certainly prefer the brilliant horse. And brilliant horses are basically brilliant because of genetic ability. Career stamina, or the ability to withstand training, has been de-emphasized in the recent past. That's also how you make a stallion. If you want a stallion to stay in the breeding shed, he has to be brilliant early. This makes the trainer's job harder because they don't have the same raw material to work with that we pine about whenever Seabiscuit was training. So performance ability is natural ability plus training. Formerly, horses probably had a little less speed. They didn't go out as fast as they go now in the races, but they were more durable and they could be trained. Now we've moved this over. They have a bit more speed, but they can't stand the training that they used to. And some of that is conformation. And if you go back, it struck me when I got to go to the Singapore Gold Cup in 2000 when they reinitiated it. And I looked at those horses. This is the kind of horse that I saw when I was a kid. Kind of a long, narrow head, gangly, taller, knock-kneed. That's not the kind of horse we have now. I think we've changed the phenotype some. So why do horses require increased time between races? Part of the reason is they're healing up. The other big thing, which I didn't stop here, or which I skipped over a little bit earlier, is that we published the trainer statistics, and I think Tom Proctor told the truth. You're going to train a horse if you don't think he's got a chance to win. Whereas we used to enter him. Why would Citation ever breeze in Chicago when he had that 16-race win streak? When he breezed, he could go out and win a race. He could get a check for the same speed. There was a walkover and 1 2-horse field in that string. And so that doesn't happen anymore. Horses fly in to run against you. All right, so cumulative stress-induced bone injury and eventually stress fractures are insidious lamenesses that eventually result in fractures. All bones are vulnerable. The distal cannon bone is highly vulnerable because it can't change its shape. It's part of the fetlock joint surface. The cannon bone can eventually get to where it's going to resist the stress, and the back of the tibia can eventually get to where it's going to resist its stress, but the bottom of the cannon bone can't. It's got to stay part of the joint. So when the bottom of the cannon bone gets sore, the horse can't He's got to change the material, but he can't do a lot else about it. So when we get training fatigue or track sour, or suddenly a horse who was always a good loader, but now he doesn't want to get in the gait. He's trying to tell you something. That horse is sore. It's not worth it to him. Horses love to train, sound horses. When they don't like to train, there's something wrong with them. And the inflammation of the distal cannon bone is perhaps the most important single lameness that we have in the racehorse. It's because of the horse's fetlock joint has evolved to the point that that's what makes a horse a horse. That's the joint that can function for the fastest middle distance animal in the world. It's a problem also in race horses and horses in other breeds of all use. I particularly like this one. That's a 3-foot fence and a 9-foot jump there, the horse going over. This is a horse that's getting a fetlock arthrodesis. He had a problem. He broke the apical sesamoids across and ruptured his suspensory apparatus, so you might argue that he's not totally normal, but his fetlock joint, for all practical purposes, looked normal until we took the cartilage off of it. Every horse I've ever fused the ankle on where you take the cartilage off that's raced any period of time has those bruises in the bottom of the cannon bone. And they just keep getting worse. And they lead to condylar fractures. They lead to palmar articular degeneration, performance-limiting lameness, other injuries, tendinitis, suspensory desmitis. It's often asymmetry. And it's contributed to by a lot of different things. We use the bone scan to confirm this, that the horse is having increased activity here. Bone scan it's not a lameness meter. Some people think that you send a horse for a bone scan, it's going to tell you where he's lame. All it does is tell you where his bones are active. And if you look at this, this may be a lame spot. This may be the soundest spot in the horse because he's staying ahead of the accumulated trauma. You have to put it together with a clinical examination. This is just an illustration of how the lateral condyle is smaller than the medial condyle, especially in the hind leg. Same in the foreleg. That's an MRI. We're looking for degeneration and flattening, and the degeneration and flattening usually happens in the medial condyle. The lateral condyle more often gets a condylar fracture. We need to diagnose them. A diagnostic local anesthesia is by far the best. All of the other things of this contribute. But here's the same, or these are different examples of what we see radiographically, these little circular semilunar depression fractures, various lines, fingerprints in the bottom of the bone, which we know are bone bruising. They might be on the condyle. They might be right next to the sagittal ridge. Here's variations of all of those things, all in the same horse. Sore on the bottom of all 4 cannon bones. And that's not a terribly unusual finding for us. I'm running short of time, so I'm going to blitz through these. Here's a horse with a marked bruise that's getting a palmar degenerative lesion in the cannon bone. You can see the sclerosis is beginning to separate. It's likely a normal response to trauma. We're just giving the horse the trauma too fast. He can't handle it. So what do you do to get it back? We encourage normal bone remodeling. Remember I said horses heal when they're moving around. A horse evolved as a grazing animal. He eats a few bites and walks a few steps. If you watch a horse graze, he eats a few bites and he walks a few steps, and he eats a few bites and he walks a few steps. That's where his circulation works the best. That's where this bottom of these cannon bones heal the best. The key is to stop these before it changes the shape of the cannon bone, because once that changes shape, he can never be normal again. So what's the prognosis? Here's a paper that we did. It came out last year. The main thing I want to show is here. Previously, all descriptions of palmar distal cannon bone disease showed that 40 to 60% of them those horses returned to racing with that's several publications, various combinations of restricted activity and medication. This group of 55 horses, which were actually sorted out of 460 horses because we only used the 55 horses that we had only this problem, distal cannon bone problems. If you just put them in the field, 95% of them raced. We didn't do anything but put them in the field as many hours a day as you possibly could. You don't give them anything. Aspirin and isoxaprine, occasionally, we didn't give those horses. So one of our man-made predilections is we don't give the horse the chance to heal that he naturally evolved to have. And that is short periods of high-intensity exercise are interspersed with long periods of rest. And they heal the best doing this. They depend upon that walking around for the blood to get back up the leg, for the circulation to work. Now, we get around it, we put stall bandages on them. But that doesn't improve their circulation. The circulation in the bone comes in the medullary cavity and out through the periosteum, and that's why they get edema on the outside, the cannon bones in the lower part of the limb. This is just treating a sign. It's not the cause. That's like getting rid of lameness and not understanding the problem. High stress exercise, we cool them out and we stand them for hours. Now, I'm out of time, so I'm going to stop with that. I can say that you can also add to the problem with track surfaces. You can add to the problem with toe grabs, with high toe grabs. That increases the stress on the bottom of the cannon bone. And that's not the only problem that they have with managing the exercise in a rate at which they can handle it, but it's the most common one in the horse that we have to be aware of. And it comes from the fact that horses are not made of steel. They can't be made elastic. They have to stay in the plastic scenario, which means that every time they exercise, they will do damage, and every time they do damage, they have to be able to repair it. And when we didn't have year-round racing, every horse had a guaranteed couple of months of reduced exercise. But now that we have the opportunity to keep going, we have to be conscious of the facts that horses are a biologic material. I think I'll stop there.